Got some breaking news coming in at the moment, and this is coming from Mengaluru in the southern Indian state of Karnataka. A suspected coronavirus patient who was admitted at the Wenlock hospital in Mengaluru has reportedly escaped. Surveillance officials and police have reached the escaped patient's home to investigate his whereabouts. Now, what we are learning is that the patient neglected the advice given by his doctors and fled the hospital. Health department officials have promised that the patient will be brought back to the hospital soon. But certainly this is alarming news coming in that a suspected COVID-19 patient has escaped from the hospital in Mengaluru. Nishchita joins us on the phone line with this breaking news update. Nishchita, over to you. What was the advice given to that patient and do we have any clue about his whereabouts?
Well, this patient had returned from Dubai on Sunday night, and upon his arrival in Mengaluru, where you have screening being undertaken at the airport as well as the port, he was shifted to Wenlock Hospital, and his samples were sent for testing. He's a suspected case, is what the health department officials have gone on to tell us, which means that he could be symptomatic as well. But today, when the hospital authorities reached Wenlock Hospital, he was not at the isolation ward, and they had immediately dispatched a surveillance team as well as the police officials to his residence. But so far, there has been no update of the patient being found. It is definitely an alarming situation. Let's not forget that this comes just a day after a family of 5 in Kerala were detected positive for COVID-19 after they ignored the state government's warnings and did not disclose their travel history. And this has also raised concerns in Karnataka, which borders Kerala, which also has a lot of expats returning from COVID-19 affected countries as well. So we are awaiting an update from the health department officials as to whether he has been found or not.
Absolutely, Nishchita. It's a huge cause of concern, isn't it? You mentioned that family in Kerala, they also returned from abroad, and despite showing symptoms, they avoided the screening process at the airport. They did not disclose their travel history as well. Certainly, Indian government has repeatedly told everyone that if you show symptoms, you must immediately contact health authorities, not just for your own health, but the health of those whom you may get in contact with. Nishchita, we are also learning that a baby is also a suspected case of coronavirus in Kerala as well.
That's right. An infant, we are being told, is also suspected to be infected with COVID-19, but no confirmation has emerged from that front. But we understand that the family of 5, the parents, a child, and 2 other relatives who returned from Italy recently, who evaded the screening, they have interacted with as many as 3,000 people in this period where they avoided being screened by the state health department officials. So now the Kerala State Health Department has the additional responsibility of reaching out to these 3,000 odd individuals that this family has interacted with and should screen them also. So it is definitely a chain reaction that will be set off if there is any amount of carelessness that is displayed by individuals who have a travel history of visiting COVID-19 affected countries or are displaying symptoms of COVID-19.
Right. Nishchita, thank you so much for joining us on that breaking news, and we certainly hope that the health department officials and the police are able to track down this suspected COVID-19 patient who escaped from a hospital in Mengaluru.